Hello everyone. So now in this session we are going to discuss about the infant CPR. So in earlier session we have discussed regarding the adult BLS, but now here we are going to tell you about the pediatric BLS. So there are slight significant changes in the pediatric BLS. So in this session we are only going to discuss about the slight changes which you can able to see or which you have to follow in case of the pediatric BLS. So as I said earlier, the infants or the neonates or the newborns, they are not suffering from any kind of cardiac arrest or the heart attack condition. The adults, they are suffering from the cardiac arrest and the heart attack conditions. But in case of the infants, neonates, newborns, they are suffering from the respiratory arrest. But later on, that respiratory arrest will convert into the cardiac arrest. That's why in case of the newborns, infants, we have to start with the compression part also. So this is the main difference between the that is your adult and the child BLS. But we will proceed with the some other significant changes which you may able to encounter in case of the infant CPR as well as the adult CPR. So the first thing is, for example, whenever you are going to see an infant is lying in a specific area and the person or the infant is not responding, there is no any kind of significant movements, because in case of infants they are not able to vocalize the things. So what we can do is we have to seek for the that is your response. So first we have to place the baby in a flat surface where the scene is safe for you as well as for the baby itself. Now what we can do is, if the child is not responding well, so what you can do is you have to check for the response. So the first step is about the that is your scene safety, second one is about the check for the response. Now how you are going to check for the response? In case of the adults, you are tapping the shoulder of the adult. But in case of infants, you are not supposed to tap the shoulder. So what we are going to do is we are going to flick the soles of the infant. So here you are going to do the flicking response. You have to show the flicking response. If the child is conscious, then he or she may cry, because they are infants and they are not able to vocalize the things. So what they will show is they will show the response in form of cry. But if they are not responding in the form of a cry itself, so what we can do is we have to shout for the helps. We can call someone, we can tell someone to call the ambulance, or they go and get the AD1. After the call for the help, then what we can do is we can check for the pulse as well as for the respiration. Here you may able to find some slight difference in the pulse also, because in case of adults what we are doing is we are checking the carotid pulse and then we used to see the chest rise. But in case of infants we are not supposed to check the carotid pulse. What we are going to do is we are going to check for the brachial pulse. This area is known as your antecubital fossa area. So here you may able to find certain veins like cephalic, basilic, as well as you may able to find the arteries which is known as the brachial artery, radial artery. So what we are going to do is we have to check for the brachial pulse. No need to check the carotid pulse in case of the infants. In case of adult you can check for the carotid pulse, because it is a mechanism where you have to go with the checking of the carotid pulse. But here there is no need to check the carotid pulse. You can go and check the brachial pulse. So what you can do is you can use your two fingers and you can palpate the brachial pulse, and with the help of the eyes you can see the chest rise. So approximately you have to spend 5 seconds, not more than 10 seconds. So you can check the pulse, that is brachial pulse, and you can see the chest rise. For example, if there is a pulse but there is no respiration, then you can start giving mouth-to-mouth ventilation, or you can start giving that is your ambu bag. With the help of ambu, you can start giving the ventilation. But in case, the second scenario is if there is no pulse as well as there is no respiration, so what we can do is we can start with that is your compression as well as the ventilation. But now, here there are few changes. For example, in case of adult, we are pressing the chest. The depth we have to maintain is 5 to 6 centimeter. But in case of infant, the depth you have to maintain is 4 to 5 centimeter, approximately 1 to 1.5 inches. And the second thing is about the hand placement. So for example, in case of adult, we have to maintain the ratio of 30:2. But in case of infant, if you are a single rescuer, then what you can do is you can go with the 30 compression, 2 breath. But in case if you are a 2 rescuer, there are 2 person who is going to revive the patient. There are 2 persons. So in case of double rescuer, you are going to maintain 15 compression and 2 breath. So always remember this ratio. For example, if you are a single rescuer, go with 30 compression, 2 breath. If you are a double rescuer, go with 15 compression and 2 breath. Now I'm going to tell you about the basic difference how you are going to press the chest in case of single rescuer, in case of the double rescuer. So for example, if you are a single rescuer, so what we are going to do is we have to check the pulse. You will check the pulse and you will see the chest rise. If there is no pulse, no chest rise, you have to spend approximately 5 seconds but not more than 10 seconds. There is no respiration, no pulse, then start giving compression. Then how you are going to give the compression? With the help of a 2 fingers. Do not apply your full hand. You have to use your 2 fingers, that is below the nipple line, 2 fingers above the xiphoid process. Now you are going to press the chest of the neonate. So with the help of this 2 finger technique, this is known as your 2 finger technique, and you have to press the chest. So as I am a single rescuer, so what I do is I give 30 compression, and you have to count loudly so that the other person may able to get an idea. So that is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 26, 27, 28, 29, 30. 30 compression. Now you will move towards the head side. Now it is important to give respiration in case of the infants. If you are doing compression in case of the adult, there is no need to give ventilation if you are not comfortable. But in case of infant, respiration is important, because as I said earlier, that is in the infants they are suffering from the respiratory arrest. After giving compression, now you will move toward this side. Pinch the nose, give head till chin lift maneuver, take a deep breath, give first breath. Wait for 2 or 3 seconds. 1 1000, 2 1000, 3 1000. Again, give a second breath. So, in case of adult, whenever you are giving a ventilation, you are giving a gap of 5 to 6 seconds. Why? Because we as an adult, we are having a respiration rate less than the infant. But in infant, the respiration is more faster. Approximately that is 30 breath per minute, 60 breath per minute, but adult is having a respiration that is your 16 to 24 breath per minute. So the next thing is, if you are a double rescuer, when you are a double rescuer, so what you can do is the one person has to stand in this area and the other person has to stand in the head area, so that the person who is in the head area, he or she is going to maintain the airway part, and the person who is in the other side, he is going to maintain the compression part. So in case of 2 rescuer CPR, the one person has to give the compression, and this technique is known as your encircling technique. So this is your encircling, or we can say 2 thumb technique. So this technique is known as the encircling technique. So like this, you are going to press the chest. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. After giving 15 compression, then the person who is in the head side, he will start giving the 2 rescue breath. So this is known as the double rescuer. So as I said earlier, if you are a single, you can start with 30 compression 2 breath. But if you are a double rescuer, then start giving 15 compression and the 2 breath. Next thing I'll tell you, as I don't have the ambu bag right now, so I can't tell you the specific technique how we are going to attach the ambu in the infants. This I'll take in the later class, but now I'll tell you how you are going to attach the AED pads in case of the infant. As I said earlier, in case of the adults, you can place the AED pad in the sternum part or in the apex part. But in case of the infants, where we have to place the AED pads, the first pad is in the anterior aspect of the chest and second pad is in the posterior aspect of the back. Why we are placing the AED pads in the anterior and in the posterior aspect? Because pediatrics are having a lesser surface area of the chest cavity. That's why we used to place one pad in the anterior aspect and second pad is in the posterior aspect of the chest wall. So this is the technique of placing the AED pads. So today, now we have discussed regarding the compression part as well as about the AED part. Now I am going to restart the procedure again. That means how you are going to initiate or how you are going to start with the CPR in case of the infant. So suppose you came across the infant. So first the patient is not responding. Now you are going to flick the sole. There is no response, then you can shout for the help. After this, you are going to check the brachial pulse and you have to seek for the chest rise. If there is a pulse but no respiration, then you can start giving respiration. If there is no pulse, no respiration, then you can start with the compression. So as you are a single rescuer, then you can go with the 2-finger technique, 30 compression, 2 breath. In depth you have to maintain, it is your 4 to 5 centimeter, 1 to 1.5 inches. 1, 2, 3, 4, 5, 6, 7, 8, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 23, 24, 25, 26, 27, 28, 29, 30. Now you will move toward the head side, pinch the node, give head touch and lift maneuver, take a deep breath, deliver first breath. Wait for 2 or 3 seconds, 1 1000, 2 1000, 3 1000. Second breath. This is how we are going to give ventilation as well as the compression to the patient. So I hope you may get a rough idea regarding the BLS of the infant also. So till then we can stop this procedure over here, and thank you so much.